So they know how to investigate, they know how to prosecute, they don't know how to prevent. That's the reason this happens.
For more than a year, 11 News Investigates reported on Medicare fraud involving COVID tests and now urinary catheters. It's impacting hundreds of Maryland residents and costing taxpayers billions of dollars each year.
And now one business owner says Medicare is ignoring technology that could stop fraud before it happens. Investigative reporter Tali Taylor joins us now at the live desk. And Tali, the business owner compares it to what credit card companies do.
Yeah, when your credit card company stops a purchase and notifies you about it to approve or decline it, Jeff Leston says that's what his monitoring service can do to help companies identify fraud. But he says Medicare's not interested. Maryland residents Kathy Matee, Denise Cunningham, and June Markland have no use for urinary catheters. But that didn't stop companies from charging their Medicare cards for dozens of catheters, to the tune of nearly $30,000.
And the next thing I know, I get an EOB, explanation of benefits, and showing that they paid it. I was like, that's how it was. I was like, I can't believe you paid this.
Documents show the Centers for Medicare and Medicaid Services caught one of the fraudulent charges, but paid the rest.
That's just an indication of how weak the oversight is. And this catheter case is a perfect example of the results of doing nothing.
Enter Jeff Leston. His company, Castlestone Advisors, LLC, provides a service that allows companies to prevent fraud and identity theft before the claims are paid.
An entity that pays the bills can get real-time data, just like a bank does when there's a suspicious credit card transaction.
Leston says his business works with unions, national companies, and municipalities to help reduce healthcare costs. But when he talks to the decision makers at Medicare, they're not interested.
We have a system that is based on investigation and prosecution, not on prevention.
During a congressional hearing in April, the U.S. Department of Health and Human Services Inspector General, which investigates Medicare fraud, was asked about the $31 billion in improper payments that Medicare spent in 2023.
Can you please highlight what CMS is doing to ensure fraudulent players are identified early and prevented from participating in the program?
We monitor claims data. When we see a spike in billing, we immediately move to investigate.
Grimm added that her office is piloting artificial intelligence techniques to better respond to fraud. Leston says it confirms what he's been told.
It's easier for CMS, rather than stopping the machinery, to pay the claim. Then they can go back and yell fraud and then try and recover it.
I've now asked Medicare for interviews a dozen times since May of last year, and all of those requests have been declined. The federal agency, headquartered here in Baltimore County, also did not respond to my written questions for this story. For 11 News Investigates, I'm Tali Taylor.